The team that's been helping us learn a little bit more about healthy skin today. You met Mona from Mona Dermatology, Dr. Mona Fouad, and she's here. Her office is in Kenwood. Why don't you go ahead and introduce your team? You guys can keep working and just tell us what you're doing today.
Okay, thank you, Liz. This is Shireen, my nurse. She helps me every day so that we can help patients. And this is Becca. She's our front desk upstairs, and she is wonderful. We're very glad to be here. So today we are going to be doing PRP with microneedling, also known as the vampire facial. The shiny look on Becca's face is actually the numbing. And so we're numbing her up, and we just drew her blood. We're going to spin it down, and then we're going to take that platelet-rich portion, and we're going to actually put that back on her skin. We're going to microneedle it, and we're going to inject it under the skin.
Okay, and what that's supposed to do, so I'm going to let you continue to go ahead and do that. You've got her blood, you're putting it in the spinner, and I recall you close that then, and it spins for roughly how long?
About 11 minutes.
And then what you're doing is you're separating the good part, as we say, or
right,
what happens?
Exactly. So we separate out the platelet-rich portion, which actually has all the growth factors. So it's like harnessing your body's own ability to rejuvenate itself.
So when you put this on, it gets delivered, and we're going to see this throughout the hour, but for people not understanding, what you're sort of doing is giving your back your own better stuff to make it come back to life, or how do you describe it?
Right, exactly. So those platelet-rich plasma has growth factors that actually help to rejuvenate whatever cell it's around. And it's been used in things like sports medicine for a long time. And so we use it in the skin to help regenerate those cells, to help build your collagen. It helps with acne scarring. It helps just a great way to just gently rejuvenate your skin.
And I know you got to hit the button to get it spinning. Yep. She's so polite. She's like waiting for us. I'm like, no polite going on here, because we need a few minutes to do that. And that's why we're checking back through the hour. One of the things I want to do is tell people a little bit about how we met you, and we did a whole bunch of stuff on skin things and facials and that kind of thing. So let's hear a little bit more about that now.
Hi, how are you today?
When it comes to your face, ask Dr. Mona Fouad of Mona Dermatology what matters most, and she'll tell you.
Honestly, number one, I'd say skincare.
And when it comes to skincare, the facial ingredients you may want to choose are in many of her preferred products. They contain sunscreen, antioxidants, and what she calls growth factors.
Growth factors are proteins that are naturally occurring in the skin, and you can find them in certain skincare products.
If you're not sure what you're looking for,
do I look for it here?
She suggests you consult a skin professional. And while all of those ingredients certainly can make a difference in looking and maybe even feeling younger over time, there's a few things now circulating, perhaps online, that you might never want to put on your face.
Some of the things I found most alarming were like breast milk facials or urine facials.
Well, breast milk, she says, is great for baby.
Apparently, people use it because they think there's some antimicrobial properties to it. But if you think about it, breast milk is a body fluid. I don't want anybody's body fluid but my own on my face.
Body fluid, she says, can transmit diseases and grow bacteria, which is why urine isn't suggested either.
A urine facial, I guess people do it because they think that it's going to help tone their skin or maybe prevent their acne. But urine is about 98% water, so it's really not doing anything.
While she says good skincare can cost you, so can damage to your skin.
Yes, they're more expensive, but you could also spend a lot of money trying to find something that works, that doesn't do much, or you could buy a couple really good products that are going to make a difference.
So we love all those options, but we also wanted to talk to you again about the vampire facial. And I know what you have to do is you have to draw blood. One of the things that happens is you have to have enough blood, right, to be able to do that.
Correct.
So you're kind of drawing another tube.
Yes.
All right. We don't want to scare anyone because people get freaked out about needles or whatever. So you go to work. We'll go ahead and just ask her a few more questions about what you're doing that. Now, when you take her own blood, that means there's no risk of rejection or anything like that.
Right, exactly. So a lot of times people are a little nervous to do fillers, for example, because they're worried that they're going to react to it, but you're not going to react to yourself.
Right.
So the great thing about this is it's your own body helping to rejuvenate itself. So I don't think there's ever been a case of somebody reacting to their own blood.
And when you put that back on then, how long does it take before you see? Because the one thing about fillers, they say, is you'll see results fairly quickly. How long does this take?
Right, so this actually is helping to build your collagen. So I'd say really most patients will say they'll see an improvement within a couple weeks. And we really suggest to do this in a series because over time you're continuing to build your collagen.
And other than the blood draw, there's really no pain or anything like that. Now, because the way you put it in, you have to kind of microneedle, or what do you do?
So the way that we do it is we actually inject it under the skin, and that really helps to get it into the place that we want it. So kind of in that second layer of skin, the dermis. And then we come over with a microneedle, and that you can adjust the depth. So some people have thicker skin, we go a little bit deeper, some people more superficial, and we microneedle the PRP into the skin as well. So we actually do it both inside the skin and on top of the skin. And so I feel like you kind of get a double improvement.
Okay, good deal. We're going to come back to that. We're going to see her get like a little bit of a red face and that kind of thing throughout this hour. I know that doesn't sound appealing, but it is pretty cool. And we are going to be moving into the month of Halloween very soon. So we're pretty excited about that. All right, you guys stay with us and we'll be right back. Pretty excited to hear that noise here, but that's okay because we want to know what that is. Dr. Mona Fouad from Mona Dermatology is here. I'm going to let you tell me as we're hearing that noise, what are you doing?
So I'm actually microneedling the platelet-rich plasma. You can see Shireen putting that on her face right now.
Oh yeah.
And one of the really nice things about there's different kits that you can use. But one of the great things about ours is, as you can see, it's not red and bloody.
Right,
and so
right.
people don't
I was
leave.
expecting that red, that really red, and it's not, so you don't leave all freaky.
No, exactly. Now,
So is it just as effective as the freaky one?
oh, absolutely. Yeah, and actually we can adjust the depth of our microneedling, and so we can go deeper and actually draw her own blood. But if someone doesn't want to have that, then the nice thing about this is they don't have to leave red and freaky.
Okay, and I know you were numbed. I'm just asking you, can you feel that?
I can feel it. It kind of feels like a cat tongue.
Oh, okay. Oh, that's interesting. When your cat licks you, that's a good way to
Yep.
put it there. So, how does this price compare to the real red or other procedures, or how do people go ahead and?
How do they decide?
Yeah.
Well, honestly, I think that prices just vary by office. And so if you do microneedling by itself, it's going to be a little bit cheaper than if you add the platelet-rich plasma, obviously.
So, what is an average cost? Because I have never done it. I wouldn't know.
Oh, sure. So, like for our cost, if you just want to do one treatment, it's about $800. But we really recommend them in a series of 3. So if you do 3 treatments, it's $1,800. So it brings the price down to about $600 a treatment, which actually is a pretty reasonable price considering the fact that you're getting the microneedling and your own platelet-rich plasma put on.
Awesome. So you just have a little bit more to do.
Yep.
I know we're going to let you guys finish up, and right at the end of our show, we'll get a pop on you smiling and looking beautiful.
Great. Thank you, Liz.
Thanks for being here today. We're really excited to have you.